Okay, Lloyd Bennett is a 76-year-old male. He is full code with no known allergies. He was admitted to the ED on May 23rd with a femoral head fracture due to a fall outdoors. He underwent a left hip arthroplasty. Now all drains are removed. His provider checked his dressing this morning and it is clean and dry. Patient complains of fatigue with physical therapy and dizziness upon position changes. Patient doesn't have a history of medical problems and is not currently on medication. He is not a smoker. His initial vital signs, he had a heart rate of 93, respirations of 17 breaths per minute, blood pressure of 104 over 68, temperature of 99, and SpO2 of 94% on room air. His radial and pedal pulse were 95, strong and regular, and he is ANO times 4. His skin is pale with a normal skin turgor. He has a capillary refill of about 4 seconds. His lung sounds are clear, and his chest rises normally bilaterally. He has normal heart sounds with regular rate and rhythm. He has normal bowel sounds in all 4 quadrants. His right forearm IV is dry, intact, and patent. His surgical dressing is clean, dry, and intact. Patient reports no pain, and I placed a pillow under his legs. His CBC results drawn at 10 o'clock this morning. He had a hemoglobin of 6.9 and a hematocrit of 23. The provider ordered a blood transfusion of 2 units packed red blood cells. After I verified the blood, patient ID and type and cross-matched them with two nurses, I obtained the informed consent, contacted the blood bank, and I flushed the IV and administered the packed red blood cells at 100 milliliters per hour. The patient reported a sudden onset of low back pain. I stopped the transfusion immediately and changed the tubing. I flushed a new line with normal saline and infused the normal saline at 100 milliliters per hour. I checked vital signs. I called the provider without leaving the patient's bedside. I checked the blood to verify the label and the ID for cross-matching, and I treated symptoms and contacted the blood bank to inform them of what happened. I then obtained a urine dipstick, which came back negative, and I obtained a venous blood sample. I assessed his blood pressure again, which was 110 over 70, and then his temperature this time also was 99 degrees Fahrenheit. Patient now reports a low back pain of a 1 out of 10. He has activity as tolerated through the orders of physical therapy. I provided patient education about his adverse reaction. His lab results at 10:50 this morning were hemoglobin of 6.8, hematocrit of 20, white blood cell 8.9, sodium 135, potassium 4, BUN 41.4, creatinine 1.6, and prothrombin time of 8. I called the provider after the results came in and they want to continue with these existing orders. I suggest monitoring vital signs every 4 hours. Watch patients' lab values and get them under control. Provide patient teaching on signs to watch for possible transfusion reaction, and continue to do physical therapy as ordered, and then continue to assess patients' low back pain. That's it.